Hello and welcome back, dear listeners, to another exciting episode of our podcast. I'm Hari, and as always, I'm joined by the brilliant Leela.
Hi, everyone. It's great to be here again with all of you.
Today, we have a jam-packed episode lined up for you all. We'll be diving deep into the dynamic world of retail with the impact of delivery apps, exploring the challenges in public health education and job market in India, and navigating India's evolving healthcare landscape.
That's not all. We'll also be shedding light on the comprehensive nutrition agenda tackling India's malnutrition challenge, discussing the importance of expanding cancer surveillance through the National Cancer Registry program, and exploring how AI is revolutionizing agriculture in Nigeria.
I don't know about you, Leela, but I'm buzzing with excitement to cover such a wide range of topics today. It's like a buffet of knowledge and insights.
Absolutely, Hari. Get ready for a longer episode where we'll take our time to unpack each of these crucial issues. So grab your favorite drink, settle in, and let's embark on this enlightening journey together.
Article 1. So Leela, the impact of delivery apps on the retail landscape in Bengaluru is truly fascinating. These apps have completely transformed the way people shop, offering unprecedented speed and convenience.
Absolutely, Hari. It's incredible how these apps have reshaped traditional retail by challenging local stores and catering to the fast-paced urban lifestyle in Bengaluru. I read that working individuals particularly appreciate the time-saving benefits these apps provide.
That's right. The ability to order groceries or essentials with just a few taps on your phone is a game changer for many. But it's not all sunshine and rainbows. Some people have expressed concerns about the quality of products and the temptation to overspend due to the instant availability of items.
It's a classic case of convenience versus caution. While these delivery apps offer unparalleled ease, there are valid worries about impulse buying and possibly compromising on the quality of goods. On the flip side, senior citizens and middle-aged shoppers still have a soft spot for physical stores, for the experience and the assurance of picking their own products.
It's interesting to see how different demographics have varying preferences when it comes to shopping. The rise of online shopping is undeniably impacting supermarkets and provision stores, leading to a decline in sales for many brick-and-mortar establishments.
Local kirana stores in particular are facing a tough battle as they struggle to compete with the discounts and convenience offered by online platforms. It's a survival of the fittest situation, and some smaller stores are adapting by focusing on essentials and catering to specific customer segments who may be less inclined towards tech-savvy shopping experiences.
The adaptability of these smaller stores is quite impressive. They are finding their niche in the market by understanding the needs of certain customer segments. However, there are definitely challenges and controversies surrounding this shift in the retail landscape.
Absolutely, Hari. One major debate is around how these delivery apps might be affecting the overall shopping experience and community feel that physical stores offer. Finding a balance between the convenience of online shopping and the personalized service of local stores is crucial. Maybe a hybrid model could be the way forward?
That's a great point, Leela. Balancing convenience with personal touch is key. Looking ahead, I wonder how the retail landscape in Bengaluru will continue to evolve. Will we see more innovations in delivery technology or a resurgence of community-focused shopping experiences?
It's a fascinating thought, Hari. The future of retail in Bengaluru and beyond will likely be shaped by a mix of technology advancements and a renewed appreciation for traditional shopping values. It will be interesting to see how consumers, businesses, and delivery apps navigate this ever-changing landscape.
Article 2. So Leela, the challenges in public health education in India seem to be quite significant, especially with the recent discussions around the impact of the U.S. withdrawing aid on global public health.
Absolutely, Hari. It's fascinating to see how interconnected global health is and how decisions made in one part of the world can have ripple effects elsewhere. Did you know that India has been working on strengthening its public health sector for years, but it's still facing various obstacles?
Yes, Leela, that's true. The surge in public health education in India has brought both opportunities and challenges. With the job market evolving and the private sector playing a dominant role, it's creating a complex landscape for public health professionals.
The dominance of the private sector is a particularly interesting point, Hari. While it offers diverse opportunities, it also limits the options for graduates seeking to work in the public health sector. The mismatch between the skills of graduates and the job market demand is a real concern.
Absolutely, Leela. And with the lack of standardized training and faculty shortages in public health institutions, it can be challenging for students to receive quality education that prepares them for the real-world scenarios they'll face in their careers.
It's a multifaceted issue, Hari. And the uneven distribution of public health institutions across the country further complicates the situation. Students in certain regions might have better access to quality education and job opportunities compared to others.
Moving on to the current relevance and applications of this topic, Leela, we can see how crucial it is, especially in light of the ongoing pandemic. The need for well-trained public health professionals has never been more apparent.
Absolutely, Hari. The pandemic has highlighted the importance of a robust public health infrastructure. Countries need skilled professionals who can tackle not only infectious diseases, but also various other public health challenges effectively.
And let's not forget the role of technology in public health education and practice. With advancements in telemedicine, data analytics, and digital health solutions, there's a growing need to integrate these tools into public health training programs to equip the future workforce.
That's a great point, Hari. Embracing innovation and staying updated with the latest trends in public health is essential to address the evolving health landscape. It's about being proactive and adaptive to meet the changing needs of communities.
Shifting our focus to the challenges and controversies surrounding public health education in India, Leela, how do you think we can address the issues of job scarcity and the dominance of the private sector?
It's a tricky balance, Hari. While the private sector plays a vital role in healthcare delivery, there must be mechanisms in place to ensure that public health graduates have equal opportunities to contribute meaningfully to the public health sector. Creating more public health job opportunities and regulating the education system could be steps in the right direction.
Looking towards the future, Leela, I believe that investing in strengthening public health education and addressing the job market challenges can lead to a more resilient and effective public health system in India. It's about laying the groundwork today for a healthier tomorrow.
Absolutely, Hari. By fostering a supportive environment for public health education, enhancing training programs, and encouraging collaboration between the public and private sectors, we can build a stronger workforce equipped to tackle the diverse health challenges that lie ahead.
Article 3. India's healthcare landscape is quite the complex tapestry, isn't it? With the shift towards insurance-based programs like ABPMJ, the focus seems to be changing rapidly.
Absolutely, Hari. It's intriguing to see how policies evolve over time. Did you know that ABPMJ is one of the largest government-funded healthcare programs globally, aiming to cover over 500 million people? That's a massive undertaking.
That's a staggering number, Leela. It's clear that the intention behind such programs is to reduce the financial burden on individuals during hospitalization. However, the concern raised in this article about neglecting primary health care is a critical point.
It is, Hari. Primary health care forms the foundation of a robust healthcare system. By focusing predominantly on tertiary care, we might be missing the opportunity to address health issues at an earlier stage, potentially leading to more severe complications down the line.
It's a delicate balance between addressing immediate healthcare needs and investing in long-term preventive care. The article highlights the importance of not over-relying on private insurance and the significance of accessible primary care for all. How do you think this topic resonates in today's world, Leela?
Well, Hari, the global pandemic has certainly underscored the importance of a well-rounded healthcare system. We've seen how strained healthcare infrastructures can struggle to cope with sudden surges in demand. Investing in primary care and community-based services could help build a more resilient healthcare framework.
That's a great point, Leela. The challenges and controversies surrounding this topic are quite nuanced. While insurance-based programs can provide financial protection, there are concerns about coverage gaps for marginalized populations and informal workers. How do you think we can navigate these challenges?
It's a tough nut to crack, Harry. One approach could be to enhance insurance literacy among the population, ensuring that everyone understands their rights and coverage options. Additionally, integrating grassroots healthcare providers into insurance networks could help bridge the gap in access to care for underserved communities.
Looking ahead, Leela, how do you see the future of healthcare financing in India unfolding? Do you think there will be a shift towards a more balanced approach that prioritizes both insurance-based programs and primary care?
It's hard to predict, Hari, but I believe there's a growing recognition of the importance of investing in primary care to achieve universal health coverage. Perhaps we'll see a gradual shift towards a more comprehensive healthcare system that values equity, accessibility, and quality care for all.
That would be a positive direction, Leela. As we've discussed, finding the right balance between insurance coverage and primary care is crucial for ensuring the health and well-being of all individuals in society. Thank you for this insightful conversation, Leela.
Thank you, Hari. It's always a pleasure diving into these important healthcare topics with you.
Article 4. So, Leela, diving into this article about India's nutrition challenges, it's eye-opening to see how malnutrition is not just about food insecurity, but also deeply intertwined with cultural, caste, and gender factors.
Absolutely, Hari. It's fascinating to note how these factors play a significant role in shaping the nutritional landscape of a country as diverse as India. Did you know that India is home to 1/3 of the world's stunted children?
That's a staggering statistic, Leela. And the article emphasizes the need for a comprehensive nutrition agenda that moves beyond current schemes like Poshan 2.0 and Saksham Anganwadi to address the broader nutrition needs of all segments of society.
Right, Hari. The call for a more inclusive approach that focuses on local food systems and engages local elites is crucial for success in combating malnutrition. Integrating nutrition practices with local cuisines is such a smart way to ensure acceptance and sustainability of these initiatives.
Moving on to the current relevance and applications of this topic, Leela, it's evident that addressing malnutrition in India is a pressing issue that requires immediate attention. With lifestyle-induced non-communicable diseases on the rise, the need for a holistic view of health as well-being becomes even more critical.
Definitely, Hari. And looking at recent news, we see how the COVID-19 pandemic has further exacerbated the nutrition challenges in India, especially among vulnerable populations. It's clear that a comprehensive nutrition agenda rooted in local systems and delivered through primary health systems like health and wellness centers is the way forward.
Shifting gears to the challenges and controversies surrounding this topic, Leela, one point of contention could be the integration of nutrition practices with local cuisines. While it's a promising approach, there might be debates on how to balance traditional dietary practices with modern nutritional guidelines.
That's a valid point, Hari. Finding that balance will be crucial for the success of any comprehensive nutrition agenda. Perhaps investing in research to understand the nutritional value of traditional foods and their impact on health could help bridge this gap.
Looking towards the future, Leela, it's exciting to think about the potential innovations and changes on the horizon in the field of nutrition. With a shift towards a locally owned, comprehensive nutrition agenda, we might see a transformation in how health and well-being are perceived and achieved in society.
Absolutely, Hari. And as these changes unfold, it's essential for listeners to stay informed and engaged in discussions surrounding nutrition and health policies to contribute to a healthier future for all.
Article 5. So, Leela, the idea of designating cancer as a notifiable disease in India is quite the hot topic, especially with the recent article discussing the expansion of cancer surveillance through the National Cancer Registry program.
Absolutely, Hari. It's fascinating how this article delves into the complexities of whether cancer should be treated similarly to infectious diseases when it comes to reporting. And the fact that Dr. C. Aravinda advocates for improving cancer surveillance through expanded registries and voluntary reporting adds an interesting perspective to the debate.
Definitely. The resistance from the Union government to designate cancer as a notifiable disease, citing reasons like cancer's diverse nature, long-term management, and privacy concerns, raises thought-provoking questions about the most effective way to track and manage cancer cases in the country.
It's quite a nuanced issue, Hari. On one hand, we have the need for accurate data collection through expanded registries to understand the cancer burden better. On the other hand, there are legitimate concerns about privacy and the practicality of mandating cancer notification due to its long-term nature.
Moving on to the current relevance and applications of this topic, it's interesting to see how the debate around notifiability of cancer is not just limited to India. Globally, there have been shifts in disease notification policies, challenging the traditional view that only infectious diseases should be reported.
Absolutely, Hari. For example, in countries like the United States, cancer is not a notifiable disease at the federal level, but individual states may have their own reporting requirements. This variance in reporting practices highlights the complexity of standardizing cancer notification on a global scale.
The challenges and controversies surrounding this topic are also worth exploring. While improving cancer surveillance through expanded registries seems like a viable solution, there are debates around the practicality of implementing mandatory cancer notification, especially considering the resource constraints in many healthcare systems.
That's a valid point, Hari. Finding a balance between collecting comprehensive data on cancer cases for effective public health planning and respecting individual privacy rights is indeed a complex challenge. Perhaps a more nuanced approach that combines expanded registries with voluntary reporting could be a middle ground solution.
Looking towards the future, it will be interesting to see how cancer surveillance evolves globally. With advancements in technology and data analytics, there may be innovative ways to enhance cancer registries and improve the tracking of cancer cases. This could potentially lead to more targeted interventions and better outcomes for cancer patients.
Absolutely, Hari. As we move forward, it will be crucial to strike a balance between the need for accurate data collection and the protection of individual privacy rights. Finding innovative solutions to strengthen cancer surveillance while addressing the unique challenges that cancer presents will be key in shaping the future of cancer management and research.
So, Leela, the use of AI in Nigerian agriculture is really fascinating. It's amazing to see how technology is being leveraged to address the challenges faced by farmers in the region.
Absolutely, Hari. The fact that AI is being used to monitor greenhouse conditions, like in Dandam Nangor's case, leading to a 20% increase in production, is truly revolutionary. It shows how innovation can directly impact people's livelihoods.
It's impressive how local startups like Green Eden and Anitsor are stepping up to provide AI solutions for farms, especially in a country where climate change and erratic rainfall pose significant challenges.
Yes, Hari. These startups are not only helping farmers like Mercy Atsuku monitor poultry farms more efficiently, but also highlighting the potential of AI to revolutionize agriculture in developing countries.
The article also raises some important concerns about the focus on increasing output without necessarily addressing the environmental impacts of farming. It's crucial to strike a balance between productivity and sustainability.
Absolutely, Hari. While AI can boost efficiency and yields, we must also consider the long-term consequences on the environment. It's a delicate balance that farmers, tech companies, and policymakers need to navigate together.
Moving on to the current relevance and applications of AI in agriculture, it's clear that this technology has the potential to transform farming practices not just in Nigeria, but globally. The ability to predict weather patterns, optimize resource usage, and enhance crop monitoring can lead to more sustainable and productive agricultural practices.
Definitely, Hari. AI can play a crucial role in helping farmers adapt to the impacts of climate change, improve their decision-making processes, and ultimately increase food security. It's not just about efficiency, it's about resilience in the face of environmental challenges.
However, it's essential to acknowledge the challenges and controversies surrounding the adoption of AI in agriculture. Limited internet access and poor infrastructure in rural areas can hinder the widespread implementation of these technologies, creating a digital divide among farmers.
That's a valid point, Hari. Ensuring equitable access to AI tools and technologies is crucial for the success of agricultural innovation. It's important to address these challenges through collaborative efforts involving the government, tech companies, and local communities.
Looking ahead, Leela, the future of AI in Nigerian agriculture seems promising. As technology continues to advance, we can expect more sophisticated AI solutions tailored to the specific needs of farmers in the region. Innovations in data analytics, machine learning, and remote sensing could further revolutionize the sector.
Absolutely, Hari. The key will be to ensure that these advancements are not only focused on increasing productivity, but also on promoting sustainable and environmentally friendly practices. The future of agriculture lies in harnessing the power of technology to create a more resilient and equitable food system for all.
Conclusion. Wow, what a fascinating array of topics we've covered today, Leela. From the changing retail landscape to the challenges in public health education, India's healthcare evolution, nutrition agenda, cancer surveillance, and even the revolution in Nigerian agriculture.
Absolutely, Hari. Each article shed light on crucial issues shaping societies and economies. It's clear that innovation and adaptation are key in addressing these complex challenges.
And let's not forget the importance of community engagement and education in driving positive change. Our listeners have a crucial role to play in spreading awareness and advocating for solutions.
So true, Hari. As we wrap up today's discussion, we encourage all of you to take a moment to reflect on these topics. How can you contribute to creating a healthier, more sustainable future for all?
Thank you for joining us today, dear listeners. Your support means the world to us. And remember, stay curious, stay engaged, and stay tuned for more thought-provoking conversations on our next episode.
That's right, Hari. Until next time, this is Hari and Leela signing off. Take care, and remember, the power to drive change lies within each of us.